How are you?
How are you? You like California?
Yes, I love it. I'm back home. This is my home, so I'm happy to be here. I still miss certain things about Atlanta. It's not as many of us out here. So it's definitely an adjustment, but work is good and busy. I'm producing some films right now. And I'm still trying to do a little bit of hosting when I get a chance and whatnot. So everything is working well for me here. But I will be back. So when I come back, I got to come back by the office when it is open and okay, and give you a hug and say thank you. I'm going to talk about that in a second. It may not take a full 30 minutes.
We got any babies coming soon?
No, no babies. See, okay. No babies yet. But I personally am a person that wants to get married first. So I'm like, I'm still waiting. I still have some time. I'm not on the ticking clock yet. Okay. But that I do have a question. I want to go on and jump right into it.
Okay, well, let's do it.
Okay, so last year we know it was a pandemic and there was a lot going on, and so a lot of people were inside the house. A lot of my associates have conceived and they are pregnant because of that. Do you think the birth rate is higher this year because of coronavirus, or?
We have noticed a slight increase, not a lot. I mean, I think women were a little afraid of getting pregnant because of the unknown. It's just everything with COVID, we don't know. We can only tell you what we think we know, but we don't know. Now, there were some women who had some oopses because they couldn't get to the office. Some did not call the office to make sure they had their contraception in place, but we've seen a slight increase. The crazy thing about COVID, though, there is a concern that we're seeing a lot of first trimester losses because of COVID, and they're not sure why. They're not sure if it's COVID or if it's the stress of the pandemic, but we are seeing where you come in, you're pregnant, but no heartbeat, or you come in and you're pregnant, next visit around 10 weeks, no heartbeat. So we definitely have seen a slight increase in that.
Oh no, that is not a good thing, Dr. Jackie. That's so sad. Because I see everyone celebrating and popping balloons, and which color is it? Is it blue or is it pink, and all that? So with the good news, I guess there is some bad news. And that's a big pill to swallow. So something else I'm wondering is, because of that and because of coronavirus, a lot of us, like myself, I feel like, maybe we've lost a year in terms of conceiving because we weren't able to get out there and date as much. We weren't able to meet our match, our partner. So what do you say to men and women that feel like they've lost a year, especially those of us that are in our 30s, now? And so the time is of essence.
I guess it depends on what side of 30 you're on. Obviously, 35 is considered advanced maternal age. And I think I've heard them rename it to geriatric maternity or something. I'm like, oh my God, well, we got to start calling it. Right. But it depends on what side of 30 you're on. And the thing about having lost a year, we're all balancing something. Everybody's lost a year. We did it, of course, out of safety. We did it out of, you're right, we weren't dating. We weren't even recommending dating. But in that loss, I believe that all pain has a purpose. So whatever we've lost, I think we'll get double for our trouble. So if you have not dated for a year, it may have been God was protecting you from something or someone. But if you're on the other side of 35, then we certainly are recommending you start considering egg freezing. And it's a new topic.
That is a big topic. I actually want to talk about that too.
Yeah, we haven't done a lot of talking about it because before the last couple of years, egg freezing wasn't as successful. It was a fertilized embryo that we had great success with, but actual egg freezing is relatively new and a lot more successful now. So we are telling women now who are 35, don't see a partner in the horizon or don't want a partner, that they should consider egg freezing.
Is 35 like the last age, or should you start sooner? Should you be contemplating this sooner? Or should you just ride the wave until you're 35 and see what happens and then make that choice?
Well, I'm not telling anybody to start looking to have a baby until they're ready. So if you're not ready at 35, we do bring it up because I think it is my job to bring it up that, I know you're 35. However, with 35, it's kind of a cross section. You know, at 35, your fertility rate starts to drop. There's a 25% chance every month that a reproductive age woman could get pregnant if she were trying. Mm-hmm. It's not considered infertility, though, until after you've tried for 12 consecutive months. 35 is also the age where we start to see an uptick in congenital abnormalities like Down syndrome and trisomies and different birth defects. So we do say you're kind of at that crossroad where you have to start thinking it's a little harder each month to conceive. And, you know, by the age of 40, you're on that downhill slide. So 35 to 40, you're kind of riding the slope downward. But after 40, you know, we're starting to kind of nudge you on your shoulder.
I'm just like, oh my God, I got a few years to get it together.
Yeah. But I don't ever want any woman to feel rushed, because we don't want women or men rushing into a situation where they're doing it just for the sake of childbirth. Because we got a lot of stuff for you nowadays that we wouldn't tell you just go get married to have a baby. But you do have to respect the fact that everything that has changed in the world, the human body hasn't changed that much. And so your eggs have been with you since you were conceived in your mother's womb. And, you know, 400,000 eggs later, we're down to 40,000. And every month you're losing an egg or two. We do say it's time to start looking toward using the technology that's been put in place.
You know, I will say this, the older you get, I'm not old at all. I'm 30, so I still have some time. But you start to look, and every time you get your cycle every month, you're like, I lost another egg. Honest, you're like, I lost another one. Right. And so,
you know, I call it, at this age, Kayla, I'm calling it, we are maturing. Yeah. We are not getting older, because older has a negative connotation on it. It's like we're maturing. And, you know, what happens is really the studies show that the brain really isn't wired as an adult until after 25. So you really have only been grown for 5 years.
Okay, that makes me feel so much better.
A 10-year window where you've got time to start contemplating what's right for your life. Because we see now with technology, we're seeing a lot of single dads become parents. Yeah. We're seeing, you know, same-sex marriages become parents. So you got time.
Yes, I love that. Okay. So what do we need to be doing as mothers and fathers to keep ourselves healthy? Like, what are some of your hacks? You know, of course, Queen Bee, you know, like one of the hottest books out. I do remember being in your office and you talking about all the things that we're not supposed to be doing to our bee and all this other stuff. So I'm like, okay, what do we need to be doing to keep ourselves healthy and feeling like we're 25, even if we're 30 or 35? What do we need to be doing?
So I think the human person is a trilogy: mind, body, and spirit. And if one part of that is broken, then it's like a tricycle. It doesn't really work properly. So mentally, right now in a pandemic, I'm telling everybody, you got to find a way to release and to find that peace, whether it is journaling. I think everybody should have a counselor on call if they need it, or a relationship with one, whether it is yoga, something you can do just to free your mind, because the thoughts keep coming. And, you know, I'm a big believer is if you think about it, you start speaking about it. And when you speak about it, you start acting on it. So thoughts become words, words become actions. So mentally, we all need to have, what are we doing? And that's my question to everybody. What are you doing for mental health right now? And then as far as the body is concerned, you know, got to be heart smart. And as Black women, you know, we don't like to work out as much. So I am saying we got to find some kind of place where we can work out, because heart smart is so important. And the heart is like your engine in your car. You can imagine never turning on the engine in the car and the oils and things aren't flowing. It's not going to work. So you have to be heart smart. Gut health is so important. I'm supporting using probiotics and eat live, egg, nuts, meats, beans. You want to eat the earth. And it was put in place for that, and stop so much processed food and stop the sugars that we're doing. And then just, you know, your spirit is So important, find what works for you spiritually. I'm not going to tell anybody what they should believe and what they shouldn't believe, but sometimes you need that place to go where you're like, okay, this is all I have, and work on it. So I do believe working on mind, body, and spirit makes us a whole person.
Oh, that's good. Now, I do remember sitting in your office also, and telling me, because I will talk about something personal I have. And I remember you told me, you helped me find out that I have fibrocystic breast. Mm-hmm. and I found that out, I think I was 25, 26 when I first started coming to see you as my physician. And, the first thing you told me was to lay off of processed foods. Yes. And what was the other thing you just said?
Caffeine.
Yeah. I you know what? I'm drinking coffee right now, but
I didn't tell you to stop it. I told you to cut back. So you okay. If it's been only a cup, you're good.
Like a cup a day, I promise you, because I'm a caffeine fiend. But what are some things we need to do to be keeping ourselves healthy in that way for women, and, for people that don't know fibrocystic breast, let me know if I'm wrong, is like, I have rope-like material in my boobs. So sometimes it can feel like, oh my God, is that a lump? And it's nothing, but I need to still be mindful a little bit more of things like that. What do we need to do to stay healthy for that? And I know that, because this year has been really hard trying to get a doctor's appointment. Like, I honestly have not been to see an OBGYN or gynecologist in over a year now because of COVID. The only women that were getting appointments were pregnant women. So what do I need to be doing to make sure that I'm keeping things under control until I can see a physician?
So one, you want to make sure you're taking the proper supplements. I've always said to reproductive age women or women who are trying to get pregnant or could get pregnant, even if it's an oops, is to make sure you're taking your supplements. You need your multivitamins. You need that folic acid that typically comes in a multivitamin. In case you get a oops, it protects you or protects your baby from spina bifida for up to 73%. So you need your multivitamins. We're telling everybody, especially African-American women, take your vitamin D3. It decreases the risk of breast cancer. It boosts the immune system. It helps with body fat distribution. So make sure you're taking your D3. We're in a pandemic right now. We've learned a lot about vitamin C and zinc being a part of your supplement regimen. Elderberry, any supplement that you can get that you can tolerate, because zinc hurt, the tablet zinc hurt my stomach. So I've gone to liquid zinc in my water. But I find you got to find a way to make sure you take care of your body. It's like a car. If you buy a car, and I don't know why I'm into cars today. If you buy a car and you don't take care of the car, it's not going to give you its maximum benefits if you don't take care of it. So you make sure you're getting your supplements. Self-breast exams, I talk about it in the Queen Bee. You should know your breast like you know your way home. So you get in every month, typically the week after your period in the tub or shower, check your breast. You want to make sure what you felt last month, you feel this month, or if there's something different, when to call your doctor, when not to. And then I talked about Heart Smart. You want to make sure you're taking care of your heart because it's your engine. And then as far as a female is involved, the guidelines kind of changed a little bit. And women say, well, I don't have to go to the doctor, but every 3 to 5 years. That's not correct. You don't need an actual pap test but every 3 to 5 years, but you need an annual exam with a doctor, particularly an OBGYN every year, because the only way we can tell you if you're developing fibroids or if something's happening with your ovaries is to do that wonderful bimanual exam that so many women hate. And then just talking about fertility. If you haven't seen the doctor and let's say you were 35, it's been a year with 36, some clinics will say, oh my gosh, she may be too old to actually stimulate her ovaries. So you need to see your doctor, your OBGYN annually, not necessarily for a pap test, but you also need to see your doctor for a bimanual exam and for a female checkup. Now, pap test, ages 21 to 29 is crucial that you're starting your pap testing. After 30 and older, you need to ask for co-testing, which is HPV. And we hear a lot about human papillomavirus. There are particular types of HPV, 16 and 18 in particular, that will cause 70% of cervical cancers. and 4,000 women a year still die from cervical cancer. So we're saying, make sure you're going to your doctor and be your own best advocate, Kayla. I like when women come in and they have something to talk about, because the exam is a discussion and a physical exam. So if you're talking to me, I know you know about you. I'm more inclined to ask more questions and know about you. So make sure you're going in your own best advocate and asking questions, because you have questions. Women just don't like to ask questions, but they have them.
It's very difficult. I know personally also, I came in and I had cells on my cervix, which were nothing, thank God it was nothing. They got removed. It was nothing. It was minor. And I was only 28 years old. So that was like really scary. I'm like, oh my God, I have cervical cancer. What's going on? Where did it come from? It was not HPV. It was not that. It was just cells. And again, there you were telling me, lay off of the caffeine and I love processed foods, which is stuff you find in Costco, the freezer section, and it's quick and it's easy. So going back though, because of sales and cervical cancer and things, why is this awareness so important right now? I know there's a lot of research being done. Why is this so important right now still? Because it seems like we're still having the same conversation and people aren't listening.
Well, in particularly with Black women, we are 2 times more likely to die from cervical cancer than anyone else. I mean, we're 42% more likely to die from breast cancer. So the odds are kind of stacked against being an African-American woman and having, poor follow-up in your doctor's office. But January was Cervical Health Awareness Month. So I was preaching the message like, listen, get in and get back to your doctors and ask for your age-appropriate testing. And the reason I say age-appropriate is because, before 21, we're not doing Pap tests. Abnormal cells. We want to see a normal Pap smear, but you can have atypical cells. You can have precancerous cells, or you may hear us say dysplasia. You can have carcinoma in situ where the cancer isn't invasive yet, and you can have cancer. But the moral of this story is Black women are dying 2 times more. So if we're dying more, we need to be doing more. And it is just, you almost need to have your own health passport where you're saying, yep, Pap smear done. Yep, this is done. So you're keeping up with it as well.
Gotcha. This is very interesting and very informative.
Yeah. And as far as health-wise is, HPV is sexually transmitted. And so we're telling young women, between the ages of 9 and 26, insurance companies will still pay for the HPV vaccine, Gardasil. And it has 9 different types in there. The 6 and 11 are genital warts. And then you have the high-risk types. We're telling women, make sure you got your vaccine. Here we are with vaccines again. But if you didn't get your vaccination before 26, just pay to have it done. It's like, this is an investment in your health. And so I'm telling women, if you didn't get your vaccine, if you didn't complete your vaccinations, go back and do it. Because we're vaccinating boys and girls now, because we know HPV is in both sex. So make sure you're doing that. Again, keep your own health passport. Got my vaccine, got my this done. So that's what we need to be doing.
Nice. Now, this is a question that I have because one of my viewers, she's a professor and a researcher, and I wrote this down because I didn't want to forget it, of public health at Mercer University there in Atlanta. And her research has been focusing on the effects of the misinformation of HPV in the African-American community. Why is the awareness so different amongst the African-American community when it comes to things like human papillomavirus, HPV?
Well, you know what? That's a hard answer because I'm thinking as a physician. And so if I took the position as a physician, I'm like, one, I always tell all women, especially African-American women, is find a doctor that you can almost have a good girlfriend conversation with. I try to move to this side of the room and say, okay, I'm your doctor right now. And when I want to tell you something like, don't fertilize all your eggs with one sperm, I'm your good girlfriend. So you want to find a doctor that you're comfortable with. And if you're seeing a doctor that you're embarrassed to ask a question, you can't share your deep, dark secrets, you probably aren't seeing the right doctor. And then reading is essential. Go to Google it and Google it again. Don't take one site. You have to, again, be your own best advocate. So do your own research, but have the very few women talk to me about HPV in the office. Very few. We just automatically order the test if you are age appropriate and you haven't had it done. But very few women come in. They come in, anything going on this year? Nope. Got any concerns? Nope. But then, you'll leave the office misinformed because you didn't ask any questions either.
Is it because it's so many, oftentimes, I should say, I'm a Black woman, so I can only speak from Black woman perspective. Oftentimes we kind of keep our health to ourselves, and it's kind of like a forbidden thing to talk about is, sex, the woman's body, man's body, in our families. Or is that one of the reasons you think, or?
Yep, I do. I agree. It's such a taboo conversation in Black families to talk about it. And, we rarely talk, or the way we were, me, and I'm older than you, the way the presentation of sex was, it was like we were whispering about it and we made it seem like it was kind of dirty to talk about it. So when we talk about sex and intimacy and down there healthcare in the Black population, it's almost, we whisper and we don't talk about it. And then you pass on the story from generation, the misinformation from generation to generation. And it's odd how women will believe mama, cousin, auntie, girlfriend, Pookie them, everybody before they will believe their doctor. So you're exactly right. It is an age-old taboo to talk about sex, intimacy, and down there healthcare.
So I have a question that I don't think anyone else has really been asking, or just in general. How are the effects for this new coronavirus vaccine when it comes to wanting to reproduce? I know I have a sister who's married, and one of her concerns with getting the vaccine, she is an RN, so she can get it, is she wants to be able to reproduce. And so she's like, what are the short-term effects? What are long-term effects? And I'm sure there's many women out there, including myself, that are concerned. I haven't been offered to be able to have access to the vaccine yet because of my age group and all of that other stuff. But what do we need to know? Is that going to affect us in any way or anything like that you know from your research?
So as I'm speaking as a good girlfriend now, the truth is we don't know. We don't know. Remember, we don't know as much we learn something new about COVID every day. What we do know is in everything I do in medicine, in life, I really do risk versus benefit. Mm-hmm. We know the risk of a Black person getting COVID, woman or man, is that we're 2.7 times more likely to die from COVID. Mm-hmm. And what we don't know is what are the long-term effects of getting the vaccine. Now, Pfizer has not had any statement saying not to get it. I know Moderna came back saying, well, we don't know a lot about it, so we're not offering it to pregnant women. But I do think as a Black person, you have to say the risk of dying is so much greater than the effects that we know of. Now, we haven't been getting the shots for 40 weeks, so we haven't seen any babies born to a mama who had the vaccine. Yes. Well, I guess we've seen it. Maybe we haven't. If there are pregnant medical professionals who got the vaccine at 20 weeks, we still haven't been getting the vaccines for 20 weeks. So we don't really know any of those answers. What we do know is we don't want you dying. So we err on the side of saying, let's do something to prevent serious illnesses and death.
Nice. I have one more question for you. So my question is, what would you say to Black women, women of color, white women, everyone? What is the key thing you want women to know about their bodies, and why is that important?
The most important message I can give to Black women, and really any woman, is to be your own best advocate. You want to take care of your body because you know your body better than anybody else. I often have women say, oh, I can't take that. Why? My mama told me so. And you may not be allergic to that medicine because mama said so, because auntie was allergic. But the biggest thing is to take care of your body and speak up. Don't allow any physician to tell you something that you don't question, especially if you don't agree. Mm-hmm. Needing a hysterectomy was one of the big things back in the day, where a lot of Black women say, well, I don't know. My doctor told me I need it. I like women to ask me why. You know, I want you to know why I am doing what I'm doing. So I try to teach and educate at the same time, whether I'm giving you, for example, fibroids. And, you know, we see that a lot in Black women. Here are your treatment options. Which of those options would you consider? And I want to know for them when they go, oh no, I don't want any surgery. Help me understand why you don't want surgery. And I have to respect their whys. But the biggest thing you can do is be your own best advocate. Then know the facts, you know, supplements, Heart Smart, you know, mental health, gut health, vaginal health, and then treat your body. And that's the name of why I came up with Queen V. Treat your body like, especially your female body, like it's royalty. You know, don't allow anybody to tell you what you should and should not do with your body. You should be the person who makes a decision for your own health, especially when it comes to sex. You know, it's like if no means no, no means no.
Mm-hmm. Gotcha.
Yeah.
I know you call it the one-eyed monster in all of the appointments that I've had with you. You're like, okay, one-eyed monster.
And I do ask women, especially young girls who have decided to become sexually active, I'm like, sex is for recreation and procreation. Now, I know at 21, you're probably not trying to procreate. So are you having a good time having sex? And if sex is not for recreation at your age, who's having fun? You know, why are you doing it? And so everything in life should be the answer to why. And not like kids, why? But you want the Bible says that all you're getting, get an understanding. And so you really want to understand, I'm in this relationship because I'm having fun. I'm in this relationship because it's headed toward marriage. Yes. But you need to hold our men accountable for being everything that you're looking for in that relationship.
I love that. Are the men listening?
Right. Or woman, you know, in today's society, we want to be honest. Whomever you're in a relationship with, if you can't express how you feel, you might not be in the right relationship where, you know, it shouldn't come off as combative. Now, presentation is important, how we deliver what we're talking about. But if you can't express yourself in a relationship, you might not be in the right relationship.
Yes. I believe that.
Yes.
I'm an advocate for that. I just recently had some conversations about that and this commitment issues. So
absolutely. And you know, that's age appropriate for everybody. Men are typically slower. And I tease my husband. I said, well, look at the chromosomal makeup. We are XX. We have 4 X's. You are XY. You're missing something in your, you know, I'm teasing him all the time. There's something missing in that chromosome. Yes.
Well, thank you so much, Dr. Jackie, for talking to me. I appreciate it. Where can we buy your book, The Queen V?
Absolutely. You can, you know, link into my Instagram, The Real Dr. Jackie, or you can definitely go to Barnes & Noble or Amazon and get a copy of the book. If you want to get it on audio and you don't have time to read, you can definitely get an audio version of the book. But make sure you get a copy of it, because I really have tried to put in this book everything I think a woman can, will, and should ask about her sex, her feminine health, and her down there health care.
Well, I appreciate it so much. Thank you for taking the time to talk with us, I should say. For every woman, every man watching this, you are inspiring, and I'm happy to call you my doctor forever.
Yeah. Anytime you need me, Kayla, I'm always here for you. So thank you.
Oh, thank you so much. Take care. Have a beautiful Sunday.
All right. Be safe.
Bye.
Bye-bye.